We're continuing our tradition of interviewing the new president of the American College of Allergy, Asthma, and Immunology. Today we're joined by Dr. Cherie Zachary, who is both a lifelong allergy patient and a clinician. After we turned off the mics, Dr. Zachary said something that really stuck with me. She said, "If you're not at the table, you're on the menu." And I feel like that line perfectly captures the impact she's making through her work. I'd love to know if you agree after listening to this episode. As always, I'm Kortney, bringing you the patient perspective, and I'm joined by Dr. Payel Gupta, a board-certified allergist and immunologist. This podcast is made in partnership with the Allergy and Asthma Network. We want to thank the American College of Allergy, Asthma, and Immunology for their support of the Allergy and Asthma Network, as well as this podcast. Now, let's get to it. You're listening to The Itch, a podcast exploring all things allergy, asthma, and immunology.
Today, we are continuing a series that we started a couple of years ago, which is to get to know the president of the American College of Allergy, Asthma, and Immunology a little bit better every year. This year's president is Dr. Cherie Zachary. Dr. Zachary, could you please introduce yourself for the audience?
I am obviously an allergist, asthma, and immunology physician. I have been in practice for well over 30 years and have worked with academic setting at Northwestern and Children's for about 7 years after my fellowship training, then moved to Minnesota, which is my hometown, and worked for about a year and a half, 2 years with what you would call maybe hospital-based position, and then moved into private practice and am on the Minnesota Board of Medical Practice appointed by Governor Walz. I'm the chair of the licensure committee in addition to everything else I do. I've been on the Medicare Evidence Advisory Committee in Washington, D.C. I've had a whole variety of different experiences that have been very useful for what I'm doing right now.
It sounds like you're the perfect person to be doing this job, really. And with that, we always like to know what drew you to becoming an allergist? Why did you choose this field in particular?
Because, like you, I am a walking IgE molecule. I have had atopic dermatitis, allergic contact dermatitis, asthma, allergic rhinitis, and food allergies since I was a child. I was referred to my allergist probably at the age of 4, and my allergist, Dr. William Sawyer Eisenstadt, actually was president of the college in 1974, and I spent about as much time in his office as I did at school, and so that was my inspiration for deciding I want to be an allergist and want to help patients that have all of the things that I have.
I think we should do a survey of all the members and see if every single allergist has atopic conditions.
I think it's pretty high.
I also went into allergy for the same exact reason. So, really quick for listeners who may not have heard the last 2 episodes that we did with the college presidents, what exactly is the American College of Allergy, Asthma, and Immunology? And what drew you to want to become the president of this association?
Well, the American College of Allergy, Asthma, and Immunology represents about 6,833 members, physicians, and 410 who are residents, and 385 who are fellows in training. And we are an organization that have prided ourselves on being the organization for the practicing allergist, an organization where the practicing allergist can come and obtain resources that will help them take care of their patients, resources that will help them navigate insurance concerns, resources that will help them navigate prior authorization concerns, and just help them in the overall daily practice of allergy for our patients.
How did you get involved with the college and get to the position where you are today to become the president?
Well, I started going to the college meetings when I was a fellow, actually junior faculty, I should say. And I always loved the college because I always felt that I came home with something on Monday morning that I could use in my office for a patient. Or I was sitting in a meeting and I said, I have a patient that has that. Now I'm going to think about this differently. So that's really how I got started with the college. And then as a lot of people who are on committees, I started working on different committees, new members committees, committee. I was there when we had the idea that we presented to Michael Blaze for junior allergists who wanted to be in leadership roles, and how do we do that. And I've been on the appointments committee, the site review committee, you name it. I've just sort of bounced all over the place in terms of different committees for the college. I think it's sort of a natural evolution when you start to become involved with the college. We have a great administrative staff that makes working with the college extremely easy. It's not painful at all. And so for a lot of people who start working with the college, they tend to bounce around to different opportunities for serving. It's really been a great privilege to serve this organization that serves all of our physicians and physician assistants do better and do the best job they can for taking care of their patients.
As a patient, I always find it fascinating that doctors take on all of these roles on top of being a doctor. And I also only really know about what the college does because of Dr. G and this podcast. And if you don't mind, I'd just love to know, from your perspective, why is the college important for patients?
We have a lot of benefit for patients. We have a lot of information for patients, whether it's Ask the Allergist. Patients can get credible information on any allergy topic that they're looking for. They don't have to go to different sources that may have information that isn't scientifically as accurate as we would like. We have a lot of shared decision-making tools for patients that can help them decide on different treatment options that they have and help them discuss with their allergist, would this treatment option be better or that treatment option be better? We have educational opportunities for patients if they're looking to learn more about a certain condition that they may have vis-a-vis allergy, asthma, and immunology. So there are a lot of resources and benefits for patients with allergic conditions that you just may not find in different venues. And it's scientific, it's accurate, it is high quality evidence. They're not having to worry about, is this snake oil? No, you're getting really high quality information.
Yeah, and that's so important. We talk about that all the time. To get credible information online is a big task now, right? Because there's so many people that are online providing information, and it's hard for people to understand what's what. And so going to an organization like the American College of Allergy, Asthma Immunology and their resources, you know that that's been vetted by real allergists, and that, again, as Dr. Zachary said, that the information is valuable and accurate and not snake oil. So lots of benefits for the patients. And as the president of the association this year, you get to create new initiatives or priorities that you start. And so what are those priorities this year for you?
Well, when I started over 30 years ago in the specialty, I'm considered one of the 10 percenters. So only 10% of the allergists were women. We have improved substantially since that time, and we are probably at 48% of allergists are women. Yay. However, where we have not done quite as well is with regard to underserved minorities. We are only at maybe 3%, and surveying the landscape, we'll be lucky to maintain that with people retiring and with the age of the allergists who are underserved minorities. So my program is to try and impact that. I am working with Dr. Carla Davis, who is the incoming president of the Academy and also is the chair of the pediatrics division at Howard. And I'm also working with Dr. Thomas Scott, who is on the board of Meharry Medical School, two historically Black colleges and universities, to see if we can't have some of their students and or residents participate in our Spark program to increase awareness of the specialty of allergy, asthma, and immunology. The board has graciously expanded the Spark program to accommodate that. And that is my presidential initiative, is to try and increase the visibility of the specialty to underserved minorities who may not have any exposure to the field of allergy. We're a small specialty. We don't necessarily have specialty programs at every teaching hospital. And so I felt that we have to go to them rather than waiting for them to try and come to us.
That's wonderful. And I think that it's really important for everyone to understand why that's so important and why we need more representation of different types of doctors out there for patient care and to make sure that we maintain good patient care. And so, can you talk a little bit about that?
Absolutely. In general, when you start looking at the data vis-a-vis underserved minorities, what you will find is that the data suggests that when they go into a healthcare system, they generally self-censure themselves because they feel that they are not going to be well received by a culture that is not their own, and they're not comfortable, and that automatically creates a communication barrier, which is often unanticipated, but can really impact patient care. If your patient doesn't trust you, if your patient is not comfortable with you, the likelihood you will get buy-in for the treatment plan that you present to them is not high. That occurs no matter what culture you're talking about. Different cultures have different ways of communicating. I'll give you an example. In Minnesota here, we have a very large Hmong community. Well, if you're trying to treat diabetes, they don't have a word for diabetes in the language. That does not exist. If you don't understand that culture, you will not be able to effectively communicate to the patient and to the community in a way that promotes healthcare. So I think across the board, it's extremely important to have culturally competent healthcare if we want the health of our patients to improve.
Dr. Zachary, can we also talk about how allergic disease is getting worse for patients and how patients that are in those underrepresented communities may be dealing with worse disease outcomes than other people, and how that also plays into why we need more representation in our physician population?
Well, patients in underrepresented communities have a host of environmental factors that other individuals may not have. They have poor living conditions with mold, with old carpet and dust mites, with cockroaches. They have the issue of living with a higher rate of exposure to environmental air pollutants, whether it's diesel exhaust fuel, being close to 100 yards from major roadways, whether it is living close to the bus depot storage area. They have a lot of environmental factors, whether it's redlining, they're living in an area that the homes were redlined. For those of you that don't know what that is, there were communities that were deemed not as acceptable many years ago. And those were the communities where you would have factories built and you would have other industry built, which is not necessarily beneficial for the health of patients. And you would have red line homes, which means that certain areas were designated not to be sold to people of color. If you lived in a home that was redlined, the science has shown you've been more likely to have allergic disease. So there are a lot of factors that go into these communities having a higher burden of allergic disease than other communities. And the need, therefore, for competent, excellent allergy care is paramount.
Yeah, and we actually have done several episodes on this topic, and one was actually done with Dr. Davis. And so we will link to those episodes so that people can understand more about disease and how your environment and the other political factors can influence where you're living and how you're living. And so for allergic disease, that's very, very important to remember. And it's very, very important to realize that people that are in these communities are going to have worse disease. They're going to have the worst asthma you've ever seen. They're going to have the worst eczema, and they're going to have poor outcomes from their food allergies. So everything is worse in communities where they're not getting the care that they need. And so having more representation is just so important so that we're thinking about those things and caring about those communities and making sure that we're doing something. And I know you mentioned that we're roughly at maybe 3% in the allergy field. Can you just give some numbers, if you have them, on what is the general outlook of where are we at just for doctors and underrepresented minorities?
Well, in allergy, we should be at 13%. So that tells you where we are not. I'll just start right there. We are at allergy, we should be at 13%. We're not any better in any of the other specialties. We're not. And the challenge also is that most minority physicians still graduate from historically Black colleges and universities. So we've got to influence that.
Absolutely. And obviously, even having 13% underrepresented minorities out there is not enough to serve everyone. And so, what I also wanted to talk about was just that when you have underrepresented physicians in practice, they can also help to train and make sure that there's education available for physicians that may not represent that minority group, but definitely treat them, right? And so that's the other element that we need to think about when we're thinking about bringing in more representation is that people of different cultures and different perspectives then help advance medical care in different directions. If they're doing research, they help bring in different research populations. And so it's a ripple effect of how much we enhance our ability to care for patients. So, yes, 13% is still not enough. In general, we don't have enough allergists to treat everyone. And so we need to all be better at understanding care for all of our patients. And that happens when we have people that can help us understand what we don't know.
What I'm hearing both of you say is that, Dr. G, you were saying that medical students don't really get exposed to allergy and immunology very often in their training, and that you, Dr. Zachary, said that you have to go and meet them where they are. And I've heard that there is an allergist shortage from allergists, but also from patient complaints because of wait times. So, what are you guys doing to address this shortage?
Well, I will start by saying Dr. Blaze many years ago started what was called the ACORN Project, which was designed to increase the number of fellowship training slots. Dr. Tracy last year revamped that program in conjunction with many of our other board members, and it is called the Pathway to Practice program. And the reason for that is that in, I think it was 2024, we had about 81 qualified applicants who did not match because the slots weren't there. And we had training program directors who had ACGME slots available that were not filled because they did not have funding. So that program has been revamped and designed to fund those unfunded approved ACGME fellowship training slots. The college is spending about $4 million, $5 million over the next 4 years to do that. And we hope to work with industry going forward to potentially expand the number of ACGME fellowship training programs so that we can increase the number of allergists that are being trained every year. Part of the problem has been that there was a contraction of fellowship training programs from quite a bit down to its current number. We were well over 100 and some odd training programs when I started fellowship, and that's contracted significantly. And so that has also been part of the challenge, but we're hoping that we can increase the number of fellowship slots to increase the number of allergists, obviously, who are coming out of training and able to serve patients.
Can I ask you what ACGME is?
So ACGME is the Accredited Council on Graduate Medical Education. They set the standards for all medical education in the United States. So every type of specialty has to meet a certain criteria of standard, whether it's internal medicine, whether it's pediatrics, whether it is general surgery. The Council on Graduate Medical Education sets the standards for these are the way and the requirements necessary to train medical students in that field, and every program has to meet those requirements, and they're monitored as to whether they meet those requirements. They are site visits that are very detailed. There are training logs that have to be kept to demonstrate that you are actually doing that. So the good part about that is everybody has a basis for training and for the scientific and patient care information that they are required to learn and provide for the trainees.
So your initiative is looking at the fellowship level, and then you want to expand the amount of fellowship slots that are available because currently there aren't enough? Or is that you want to create more opportunities in areas or in schools that never had that option?
For my particular initiative, it's probably a combination of both because Jim Tracy's initiative, Pathway to Practice, is designed to expand the number of slots available for fellowship. And we're hoping as an organization to continue that expansion going forward so that we can train more fellows and produce more allergists. My particular part of the initiative is to actually go to the historically Black colleges and universities to try and work with them to increase exposure to the specialty so that students and residents would think about allergy as a specialty that they may want to consider as a career.
Thank you for clarifying that. We need to give this new cohort of potential allergists the opportunity to become allergists. So, first, we need to raise more awareness, which is what your initiative is doing. And second, we need to give them the opportunity to apply to more positions because obviously we need more allergists. So, it's a twofold thing. And I think that's really exciting to hear that you guys are really getting to the root of the problem, which patients just like to complain about. There aren't enough allergists. Well, it's not that there aren't enough allergists. It's like the system hasn't allowed enough allergists to come out. But you guys are solving that problem right now.
We're attempting to solve that problem.
So we've talked a lot about fellows and trainees. And what advice would you offer them as they look at potentially going into the field of allergy and immunology?
Obviously, I think it's a great subspecialty. It is very interesting. It is changing rapidly. The learning curve never ends. You will constantly be engaged. You will constantly be interested. But also, allergy offers a good quality of life. You're not the high ranking surgeon that is going to work 60 to 80 hours a week for 30 years. You actually can do a better job of having work-life balance and enjoying what you do. So I think that allergy is one of the best specialties that you could go into. And there is such a need that we're not overcrowded as a specialty. We are so underserved. You have so many options for what you can do, where you can practice, so many things that you could impact, whether it's in an urban setting, whether it's in a rural setting. You just have so many opportunities. I would strongly encourage people to think about us as a specialty to go into for their career.
I second all those things. And I always mention that I thought about going into oncology at one point, actually pediatric oncology. And I realized early on that I wasn't meant to go into pediatric oncology because I couldn't really deal with the death and dying that's involved in certain fields of medicine. And so you also have to, I think, as a trainee, understand that certain fields may sound really appealing and it may sound like you're going to make a big difference in a certain way, but you have to understand your own mental health and whether or not you will be able to go day in, day out and have those outcomes for your patients. And so that's also something that I love about allergy and immunology. It's very rare that we have poor outcomes in our patients. And so we are helping people and their quality of life. And that's one of the reasons also that I personally chose allergy and immunology.
Ironically, when I was a resident, I was encouraged to go into oncology, being told I'd be very good at it. And for the exact same reasons I said I can't do it because I can't turn that off at night. And I'm going to be morbidly depressed because I can't fix this. I can't make this better. I'm going to have patients that are going to die, frankly. And for allergy for me was I can actually make this patient better. I can actually get them on a treatment regimen and have them come back in 6 weeks and say, oh my gosh, I didn't know I could feel this good. So for my personality type, for the very same reasons, I said, Yep, allergy is a good fit for me.
That's important for every trainee to realize about themselves because burnout is a real thing and you can get it in any field. But I think in those high intensity fields, sometimes it's more and you have to know what your personality type is.
Yeah, and how much weight can you carry? That's the other piece. Not everybody is built to do that. Some people, if they try to do 60 to 80 hours a week consistently, that is not going to work well. They're going to really find themselves in a bad place. And that's not an indictment. It's just, as Dr. G said, you really have to recognize, who am I? What are my capabilities? And what are my limitations? And it's okay for you to have limitations as long as you know what they are and know how to work with them.
Thank you so much for sharing this. I feel like as a patient, I've just like heard stuff that you don't get to hear very often. And so I really appreciate hearing what is going on in the minds of doctors when they're looking at what specialty they want to do and how they got to where they are. And also just, I think the more you know about the system, the medical system of how doctors get to where they are, can also give you some more compassion as a patient who I know I've waited many, many, many months to see specialists. And I have to remember that it's not the fact that the doctors are making these decisions, but they're up against something. And so there's a lot of demands on allergists. And as a patient, to hear kind of the other side of the story has been eye opening. And I just want to really thank you for the initiatives that you're going to be putting in place this year to hopefully solve for these hardships that patients sometimes feel.
And Dr. Zachary, for patients and families managing allergic diseases, what message do you want most for them to hear right now?
That the allergic disease you have does not in any way have to impact your quality of life. You can have a full quality of life and do pretty much anything you want to do, and allergic diseases don't have to be a limiting factor in that. I probably couldn't have said that 50 years ago because we didn't have the treatment options that we have now. That with the treatment options we have now, allergic disease does not have to limit your life. It just doesn't. You can do whatever you want to do. So it is in your best interest to work with an allergist that can help you achieve that, because we should be able to help you achieve that.
That is so true. I have to say that, first of all, meeting Dr. G has changed my path to having managed disease. She's finally got me on track where I really feel like there are no limits anymore. And, 10 years ago, that wasn't the case. There weren't the options that I currently have to feel as free and as healthy as I currently do. So I just want to reiterate that as a patient, I don't think we could be living in a better time to have food allergies, asthma, eczema. There's so much exciting stuff on the horizon, I think, to make our lives even better. So again, it's just so true what you're saying.
Yes, I absolutely agree. Our field is constantly evolving and we have so many more options, and patients should never feel limited by their allergic diseases. And so thank you so much, Dr. Zachary, for everything that you are planning for this coming year. We're so excited to have hopefully a follow-up conversation at the end of the year to see how your year went and to follow this journey, because this isn't just a one-year thing, right? This is an initiative that is going to be a legacy of yours. We are going to see that ripple effect of what you're starting now for generations to come. And it's really going to make an impact in the treatment of patients. Thank you so much for being here and for helping us get to where we really need to be, that 13 to 20% of physicians that are representing the population more accurately.
It's been a pleasure. I look forward to this continuing year.
Thank you for listening to today's episode. Remember that all information you hear today is for informational purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. And also, don't forget to subscribe to our podcast. And if you have a second, help spread the word by rating our podcast and sharing with your friends and family who might also be interested in learning more about allergies, asthma, and immunology. You can always stay up to date by checking out our Instagram, The Itch Podcast, where you can leave questions you are itching to know, or check out our website, which is www.theitch.com. itchpodcast.com, which contains more information about the subjects we covered in today's episode and every episode. Until next time, have a fabulous week.